have shin splints, you're probably a runner or play a sport that involves a lot of running or sprinting, or you may even participate in something like gymnastics or competitive cheerleading where there's a lot of impact and bounding involved in the sport. All of these things can cause shin splints, and I'd like to kind of dive into some nuances to this and kind of the two major buckets that these fall into as far as recovery and getting you back to playing those sports that you love. So the first thing we need to determine when you're having shin splints is whether we're dealing with a muscle or tendon related issue or whether we're dealing with a bone stress related issue. And those are kind of the two major camps that fall under the shin splints category. And so let's chat first about kind of the muscular tendon related one. So that is called medial tibial stress syndrome, MTSS for short. Now that's going to be your pain that is kind of diffuse, achy pain kind of along that inner shin area. And this is more of a muscular tendon related issue. There's a muscle called the posterior tibialis that runs kind of right behind that shin there, and it actually goes all the way to the bottom of the foot, and it plays an important role in controlling pronation, which is when that arch kind of flattens into the ground. And if that's done in excess or is happening too quickly, whether it's in the running stride or specific to your sport, that can just place a little undue stress and create something similar to a tendonitis. Now, it's important to distinguish when we're dealing with a MTSS case or whether we're dealing with a bone stress injury case. Now, a common test that we can use is called the 10 centimeter rule. And so 10 centimeters is usually about the width of 4 fingers. And so if we think about the area that we have pain, if we put that 4-finger width on there, if that pain is more broad and diffuse than that finger width, then we're probably dealing with something more like medial tibial stress syndrome, so more muscular or tendon related. But then if that area of pain is concentrated, if it is kind of within that 10 centimeter kind of pinpoint spot, we might be dealing with something a little bit more bone related. So now when we think about bone stress injuries, the biggest thing that we want to talk about first is kind of the construction of that bone. So the bone is made up of 2 different components, and sometimes I compare this to an M&M. So we have that hard candy shell on the outside, and then we have soft chocolate on the inside. That's kind of similar to how your bone is constructed. So we have a very rigid, sturdy cortical bone on the outer of that shin, and what that does is helps us bear weight and keeps us upright. And then in contrast, on the inside of the bone, we have what's called medullary bone or spongy bone, and that is where we can actually absorb a little bit of force, and it's also where all of our bone cells are created. Now, when we have an insufficiency fracture or a stress fracture, what is happening in that process is that the bony breakdown is not being kind of kept in balance with the bony buildup. So when we run, when we work out, we're actually placing a stress that is kind of breaking down that bone, and that's a natural process. But when things are in equilibrium, the bone is also being built back up simultaneously. So we want to keep those things in balance. Now, when the stress of our activity, say high running mileage, goes up, and then we're not getting enough recovery, over time, that bone creates some areas that are not now as structurally sound. And over time, they can break down and lead to a fracture over time. Now, if you're still watching this video right now, I'm assuming that you have shin splints, or if you've had them in the past and you'd like to prevent them coming back. This is where I'm going to mention I'm going to make a part 2 of this video where I'm going to show you 3 of my kind of go-to exercises for many of these cases. So be on the lookout for that. That being said, each one of these cases happens along a continuum from mild to severe cases, whether it is maybe the starting of a bone stress injury or whether it is a full-fledged stress fracture. Those timelines can fluctuate a ton. And so what I would invite you to do, if this is something you're dealing with, I would find a provider in your area that knows these injuries, that knows your sport, and can help you navigate this injury process and getting you back to full function. Now, if you are around the Charlotte, North Carolina area, we at TruMotion Therapy would love to help you out. Please visit our website at TruMotionTherapy.com, where you can get more information, see more resources, as well as have the ability to schedule an appointment with one of our providers. And we would love to help you out and get you back running or back to the sport you love.